So first I would like to ask for your permission to use this video for educational purpose and on the internet.
Yes.
Tell me about your symptoms before the surgery.
Prior, if I were to lift anything heavy or do strenuous sports activities or whatever, my back would be, out of commission for a couple days.
Oh wow, okay. How long did you have those symptoms?
About 15 years.
Well, how did you live 15 years with that pain?
I just did what I could and avoided a lot of things.
Yeah. 1 to 10, how bad was the pain?
It would get to an 8 or a 9 some days.
Okay.
There's days I couldn't get off the floor, so.
Yeah. No, obviously in that time frame the pain was significant, changing your life. What did you hold back to get it fixed? Or what did you do besides just living with the pain?
I did the chiropractor thing and some stem cell injections.
So you did on and off some other treatment and
Yep.
so on. But you didn't consider the surgery.
I saw a surgeon. I chose not to go through the.
Why not?
I just had too many things to do to be laid up for that long.
Yeah, for that long. Well, how much were you going to be laid up for after that surgery?
I guess I don't remember how long you said, but.
Yeah, generally, we say after open surgery, you're laid up or you cannot return to full activity at least for 6 months or even longer.
Yeah.
Is that what you
Yeah,
probably
pretty much.
remember? Okay.
Yeah.
But we did go through your surgery. And you're sitting there, not like somebody who had a surgery 3 weeks ago, but your surgery was 3 weeks ago.
Correct.
How long did you stay in the hospital?
One night.
One night. And I have the record of the surgery we just looked at. Your surgery just was 90 minutes. And we lost about less than half a cup of coffee, blood in your surgery. And you stayed just over the night and went home. So how is the pain that you had for so many years since the surgery?
I haven't had pain in my back since I woke up from surgery. So.
Okay, that's fantastic. Now, obviously, everything we did that minimal invasive. So the surgery itself didn't destroy too much tissue, and that is why people return to basic activities so much faster after this surgery. Now, I like to turn around and show. This is the spacers that we put in, and they are in fantastic position. You see how bad your bone spurs are. They are trying to grow by itself. Now we helped it for that to happen. And here are the screws. They are perfectly positioned exactly where they need to be. And some people say to position those screws so perfectly, you have to use a robot or a computer. We say, no, you just have to use training, lots of training, and you're perfect. You see the screw is same size as the structure it has to go through and is dead center. And because we use 2 C-arm and we use lots of training, in almost every single screw is perfect. And the spacers are good position, and the hole where the nerves are going out, they're all open. And obviously your pain is gone, and that is the best proof of that you don't have to destroy your back to get the job done. May I have a quick look on your back to see how they look like? We are 3 weeks out. They are still healing, but this small incision on the side is where we put those 3 spacers on. And these screws, small here, they are where we put the rods, the screws on. So the spacers here, 2 screw here. That's why this one is a little bigger. And this is to pass the rod. You had a special situation because of your spine was so narrow. For one of the spacers, I had to go to the other side because it wouldn't give me any space to go in safely from this side. So I had to approach it from both sides. Please have a seat. And this is what you see here, that this one, you see that this one is actually going from the right side. You see it's facing this way. And this one is going from the left side. So we had to, really work around how we are positioning. So your situation was even a little more difficult situation. But again, by being able to constantly train on this, we can do that with small incision, whereas a regular way of doing that is literally filleting you open. Now, are you back to your basic activities, or are getting close there?
Getting closer.
Okay.
I missed a couple days of work, and that was about it. So,
How many days of work did you lose?
about 3.
So you went back to work 4 days after the surgery, or?
Yeah. Part-time, yep.
Yeah, part-time. Wow, wow. And after 3-level fusion, that is amazing. But obviously we don't want you to overdo it, and some physical therapy will help you to how to return to your life in a correct way without overstressing your spine, and let your spine, your body guide you. But you return to work after 4 days after 3-level fusion. Obviously, you're a tough person, no question. Okay, but this is actually amazing. I believe many of my colleagues will not, if I tell them I did that surgery in 90 minutes, you stayed 1 night in the hospital, and you return to work in 4 days, most of my colleagues will not believe me. But here you are.
Yep.
Overall, happy with the results so far?
Very.
Excellent. Well, thank you so much for the interview.